Hello, my name's Vinod Patel. I'm Clinical Director for Diabetes at NHS West Midlands. I'm also Professor of Diabetes and Clinical Skills at Warwick Medical School and work as a consultant in endocrinology and diabetes at the George Eliot Hospital NHS Trust in Nuneaton.
Hello, I'm Sachin Katecha, Local Professional Network Chair for Pharmacy West Midlands. I'm also a community pharmacist by background. So ADEPT is the culmination of many years of work. It's a combination of 1,000 slides that Vinod produced himself. It's a program of modules which is developed to support pharmacy teams to achieve diabetes excellence through pharmacy teams. That's what ADEPT is about. So what we're trying to do is support pharmacy teams who see patients with diabetes on a daily basis to have the confidence and the skills and the knowledge to have meaningful and useful interactions. The reason we developed this program is to support teams to be better at what they do. So when you see a patient with diabetes with 4 or 5 different medicines, it's about how we as pharmacists, as healthcare professionals, can motivate that patient to take their medicines properly, to self-care, because we actually see them for 30 minutes, maybe a year, maybe a few minutes longer, but the patient lives with themselves for 500,000 minutes a year. So the only person who can make the biggest difference to themselves and their diabetes is the patient, but they can't do that alone. The NHS talks about self-care. Self-care is not about caring by yourself, it's caring for yourself, and we as healthcare professionals are really well placed to support these patients with the right information and knowledge to motivate them and empower them to make a difference to their diabetes. So if you go through the ADEPT modules, it is hard work. We've already run some trials with Coventry University with 4 face-to-face sessions, and what we found is that giving up some time in the evening, etc., is quite challenging. So what ADEPT is to motivate you or to encourage you to self-learn about it and identify gaps in your own knowledge, and then fill those gaps with the information that we have for you. And by the end of the program, you'll be confident in care planning, to be able to use the alphabet strategy to support patients to make sure that they're on the right therapies, that they're using the therapies as proposed, that they're making their own healthy lifestyle interventions. So it's about giving you the confidence moving forward to support your patients with diabetes. We hope that you enjoy doing the course as much as we've enjoyed preparing it. It is a culmination of several years' worth of work, and the whole purpose of this is not to try and tell people or teach granny to suck eggs. The whole purpose of this has been to just motivate people and engage with people, to empower them to support patients with diabetes. As I said, we really hope you enjoy the course as much as we've enjoyed putting it together. Thank you very much for listening.